Welcome to the WRAL Daily Download. I'm Elizabeth Holmes. Major healthcare changes are coming for hundreds of thousands of state employees, retirees, and family members. Starting next year, state health plan premiums will go up, and a new provider system could change what members pay for care. WRAL state government reporter Will Doran has been all over the story, and he joins us now. A reminder, we are recording this on Friday, July 10th. For the latest on this story, be sure to go to the NC Capital section of WRAL.com. So, Will, the state health plan made some big changes today.
Huge, yes.
Huge changes, and it's going to impact a lot of people. Let's start with the premiums. Members are going to have to pay more. What is that looking like?
So it's complicated, right? Because last year they changed to this new tiered system where you actually pay different amounts based on your salary, which, I think a lot of people aren't really familiar with, but that's the way that the state is operating now for the state health plan. So if you are kind of in the lowest tier, you are, fairly low paid, you just have an individual plan, you don't insure any family members, your premium is going to go up $1.76 a month. So basically nothing. For the people on the complete other end of the spectrum, though, it's going to be more. Their premiums are now going to be over $880 total. They're going to have about a $32 or $33 a month hike in this. If you're, very well-paid state employee who has your family on the plan and you choose kind of the Cadillac option of the plan. So anywhere between, $1 a month to almost $33 a month, anywhere in between, depending on what you got.
And officials still say, though, that members could end up winding up paying less for health care. How does that work? How could this actually save people money if we're hearing about these premium rates going up?
Right. So this is the tricky part. And it's this completely new system of basically asking people to shop around for their health care. And if you do it right, if you do it the way that the state wants you to do it, you could be saving thousands of dollars a year. But if you do it wrong, you could end up actually paying thousands of dollars more per year. And so let me break it down. It works like this. Every single hospital system, healthcare provider chain in the state is getting separated into one of three categories. You have preferred providers, which, as the name suggests, that's who the state wants you to go to if you're a state employee. Then you have the access people, which is kind of like a neutral, you can go to them if you want. We're not going to punish you if you do. And then you have the non-preferred providers who essentially you get punished for going to those hospitals, to those doctors. And this doesn't apply to everything. It's not going to apply, for example, to emergency rooms. If you get in a car crash and you get taken to the ER, they're not going to charge you a bunch more money, even if you go to one of these non-preferred hospitals. I think we can all agree that kind of makes sense. For people who are cancer patients, transplant patients, pregnant women, new parents whose kids are still in the NICU, none of them are going to be affected by these changes either. Kind of the most stressful sorts of health situations you can think of. They're not going to be presented with having to change their doctor, at least in the first year. Now, after the first year, things could change. But at least starting in 2027, which is when all of these things are going into effect, that's not going to change. But I'll do the math for you, for instance. So if you are an individual right now on the cheap version of the plan, your out-of-pocket maximum is $6,500 a year. That you could pay as much as that. You're not going to pay more than $6,500. Under this new version of the plan, if you go to these preferred providers, your out-of-pocket max is going to drop to $4,000. That's the rate that it was in 2012.
Wow.
15 years ago. And so, you could be saving $2,500 a year doing that. And this is the cheap plan. If we're talking the more expensive plans, I think the savings go up to $7,000 a year. But on the other hand, if you go to these non-preferred providers, that $6,500 a month that your out-of-pocket currently is, it's going to go up to $6,500 a year. It's going to go up to $12,000 a year. So they really want people to not go to certain providers and to only go to other providers.
So who are the providers? Who are the chosen ones versus the not chosen ones? Why would it be more expensive to go to one versus another?
So this is the whole system that the state has, is they have been negotiating with all of these hospital systems around the state for new rates. And if someone has agreed to essentially charge the state a whole lot less, that's how you become a preferred provider. And so for probably most of the people who are watching this in the central North Carolina area, that is going to be UNC Health. Mm-hmm. And so, a lot of people are already in UNC Health. So great news. You're just going to automatically be saving money. Yeah. The non-preferred providers, or there's another preferred provider who is Novant, which they exist in the Triad area, in Wilmington, some other parts of the state. The non-preferred providers, there's a few of them, but Atrium is the big one out in Charlotte. And so this is going to really affect people in Charlotte. But of course, Atrium is also talking about maybe partnering up with Wake Med and bringing them on. And so, that could affect things in the Triangle as well. If that deal goes through, a lot of ifs there. We don't know yet where they're going to put Duke and Wake Med. They're still working on the details, but we know essentially that one of them is going to end up in this non-preferred list in the Triangle region. So, if you are someone who doesn't go to UNC Health, you could be facing the prospect, if you're on the state health plan, of paying a whole lot more money to keep your doctor starting in 2027, or saving a lot of money if you want to switch over to UNC.
So obviously hundreds of thousands of people are going to be impacted by this. Yeah, obviously state employees, their families, retirees. How many people are we talking about here? Over
750,000 people are on the state health plan. And yet you're right, it's not just those active state employees. I think there's around 500,000 people who are on kind of the main state health plan. And those are the people whose premiums are going to be going up. The retirees, the people who are on basically the Medicare Advantage version of the state health plan, their premiums are not going up. They actually voted last month on them. Some of their deductibles are going to be going up, but their premiums won't. So kind of different ways of treating, the active state employees versus the retirees. But in general, they're looking at both groups of people to try to find more ways to make more money.
And you and the NC Capital team have reported that this is not the first time that prices have gone up on the state health plan just this year. First of all, what happened? And then second of all, why is this not the first time that prices are going up?
Sure. Well, like I mentioned, today's premium hikes were just for the active people, but those 500,000, current state workers. Mm-hmm. Last month was when or maybe it was 2 months ago, people need to correct me on that, was when they hiked the deductibles and the out-of-pocket costs for the retirees. And again, those are all taking effect starting in 2027. Mm-hmm. And then, of course, starting, earlier this year, people also saw their premiums going up because of a vote that got taken back in 2025 to hike premiums. And this all has to do with essentially the fact that the state didn't increase premiums on anybody for 8 years under former Treasurer Dale Folwell. And that was great for state employees who saw their premiums stay flat. It was not great for the health of the plan, which went hundreds of millions of dollars into the hole, essentially covering all those costs, because we all know healthcare costs didn't stay flat. Even though their premiums weren't going up, the amount of money that the state was paying was going way up. And so there was a new treasurer, Brad Briner, who came into office in 2025 and said, this is bad. And he's been honest. He's like, look, I know it's not popular. No one wants to pay more money. Mm-hmm. But the fact of the matter is, if we want this to stay solvent, if we want to continue having a state health plan, we're going to have to raise some premiums. And so that's why they're doing the premiums. That's also why they're doing this whole new preferred versus non-preferred system to get the lower rates from the hospitals. They think that it should be a win-win for everybody. Even though the hospital is charging the state less, the state is shoving tons of volume to those hospitals and those doctors. Mm-hmm. So even though they're charging less per patient, they're getting a whole lot more patients.
Right.
And so the idea is that the hospital still actually earns more money. Mm-hmm. The state saves money. And just the people who lose are the hospitals who get left out of the deal, and especially the ones who get that non-preferred status.
Right. So this is also not the first time that officials have made a switch to the plan administrators. This is happening again after there was a switch last year.
Yes.
So what's going on there? Why are they making these switches?
So for years, 40 plus years, Blue Cross Blue Shield ran the state health plan. They were kind of the ones who negotiated a lot of the deals. When you looked at your card, it said Blue Cross on it, even though it was technically the state. Back in 2023, they changed that. It led to this whole long legal fight, and eventually Aetna won. It got the contract. There have been a ton of complaints about Aetna, and again, all of those prior decisions were under the former treasurer, Dale Folwell. This new treasurer, Brad Ryder, comes in and says, yeah, I'm hearing those complaints about Aetna too. I don't really have the same priorities as the last treasurer did, and so we're going to switch back to Blue Cross. And so that's what we just learned today. Now, is Aetna going to sue over this just like Blue Cross did last time? I think they said today that literally every time they've ever given out a contract, someone has sued over it who's lost. Because, we're talking a multi-billion-dollar contract. The state health plan spends about $3 to $4 billion a year. So, this is big money if you can land this contract. It's the biggest contract in the state. No one else has a group of 750,000 employees that they're insuring. So these health insurance companies really want it. Big win today for Blue Cross, and obviously a big loss for Aetna. We'll see what happens in court after this.
And again, you mentioned that this was really to save the state health plan money and keep it going. Your reporting says that it could save the state health plan about $1 billion. How much will it actually save the plan members?
That is a great question. So what we heard from Treasurer Briner today was, over the course of, it's a 3-year contract, so it's $12 billion for 3 years. And he said that will save the state about $1 billion compared to what Aetna would have charged. So that's nice, right? And having an extra $1 billion. Now, things could fluctuate. Maybe it's a little bit more than $1 billion, maybe it's a little bit less than $1 billion, because, healthcare is complicated. But the question, does that get passed on to the members? Hard to say, because really what they're doing is just trying to dig out of a hole. They're in a deficit by hundreds of millions of dollars. So, a lot of that money is just going to be bringing it back up to essentially, the stable level that you want to have in reserves. Is there a chance that they end up, freezing premiums or even dropping premiums? I asked him this the other day. He said, look, basically you have some choices. We could freeze premiums, but if we did that, we wouldn't be able probably to do as much as we are with this whole preferred, non-preferred system where we're dropping people's out-of-pocket max. And so they've essentially come down on the side of people who are more sick or need healthcare more. If you're someone who just pays your premium, never really goes to the doctor, it's not really working that great for you. You are paying more money. But a lot of state employees, especially kind of compared to the average population, are less healthy. And that's something that they know. State employees need more healthcare kind of than the average North Carolinian. And so they're saying, sorry, healthy people, your premiums are going to keep going up. But for the unhealthy people who are doing lots of doctor's visits, seeing lots of specialists, getting lots of prescriptions, you're going to be saving tons of money. And so, but part of the reason why we're doing that is because we're raising these premiums. So that's a long-winded way of saying probably going to see continued premium increases. But, if it's like this one that we saw today, some people are going to pay an extra $2 a month. I think a lot of people would be able to afford that, even with the raises they got. Most state employees got a 3% raise, less than the rate of inflation, but certainly more than $2 a month.
Right. And so at the end of the day, it may kind of boil down to people's decision to stick with a doctor that they may have had for years and years and years, even if it is like a non-preferred network, or make the switch so that they can save money in the long run.
Exactly. And, if you're someone who doesn't go to the doctor a ton, then, if you want to keep going to this non-preferred and you're not going to hit your out-of-pocket maximum anyways, then that might not be a very tough decision, especially if you really love your doctor. But if you're someone who does use healthcare a lot and is always hitting those out-of-pocket maxes, then you're really going to want to reconsider and start shopping around, because you could be out thousands of dollars.
Wow. Well, Will Doran, thank you so much for breaking this down and taking a very complicated thing and
making
very
complicated.
Understandable. We really appreciate it.
Thanks. Good talk to you.
That was WRAL state government reporter Will Doran. For his coverage of the state health plan, go to the NC Capitol page on our website, WRAL.com. And thanks for listening to the WRAL Daily Download and for making us part of your morning routine. Another great way to get WRAL news is the Morning Briefing newsletter. It's a daily email with Triangle news, events, and headlines to help you get ready for the day. Sign up at WRAL.com/newsletter.